Today we're going to be talking, the first medication is going to be Naloxone, also the brand name of Narcan. The classification, it is a narcotic antagonist. It works on opiates and any opiate derivative. It is a competitive narcotic antagonist. The mechanism of action, it reverses all effects due to opiate and opiate derivatives. It has a higher affinity to the receptor sites and competitively binding to opiate receptors in the brain and the spinal cord, thus reversing any opiate overdose. It will reverse the respiratory depression and CNS depression in the body. So pharmacokinetics, IV, IO can take effect within 1 to 2 minutes. IN can take a little bit longer, up to 5 minutes. Half-life is generally 30 to 90 minutes. Some opiates may require second doses because they have a longer duration of action. The indications, it is to reverse the respiratory and CNS depression induced by opiates. Some of these signs may be respiratory depression or apnea. You may see altered mental status and or unresponsiveness. Also included constricted pupils. You may find some drug paraphernalia on the scene. Narcan doesn't have any effect on any benzodiazepines or methamphetamines. Contraindications, newborns and or neonates of addicted mothers. You may see seizure due to abrupt withdrawal. Adverse effects, they're not really clinically significant, but you may see patients experience tachycardia, disorientation, nausea and or vomiting. Severe agitation and aggression may be noted. Some may say this is due to the withdrawal symptoms, but it may be due to the fact of the hypoxia to the brain. Seizures have been noted after Narcan administration due to the combination of other drugs such as cocaine. The dosage for adults, it's 0.4 to 2 milligrams IV, IO, or IM. Or for the intranasal route, it is usually in a pre-filled syringe, 2 milligrams per 2 ml. You may repeat it to maintain respiratory effort. Some law enforcement agencies and or the public are actually readily carrying Narcan now, so you want to see if they have given Narcan prior to your arrival. They are usually carried in 4 milligram auto-injectors. For pediatrics, the dose is 0.1 mg per kg, IV, IO, IM, IN, and that's going to be up to a max initial dose of 2 milligrams. The max total dose will be 0.5 milligrams per kilogram, and it may be needed as necessary to maintain respiratory effort. Again, some narcotics may require higher doses of Narcan, such as fentanyl and or carfentanil. Big thing to note is during patient assessment and patient care, the treatment of hypoxia, especially during cardiac arrest, is utilized with high flow oxygen, BVM ventilations. That should be the priority for any opiate overdose. Prior to your Narcan administration, you want to make sure these people are getting good oxygenation ventilation.